they may not be able, we don't want a lot of wound stress, because we talked about wound stress causing problems with non-wound healing. And so I could say, you know what, the doctor has asked that you dangle at the bedside, so I'm going to help you come over to the side of the bed. Oh, I know, this is this person with the, sorry, with the Tootsie Rolls. Sorry.
Not eating that anymore.
All right, so one thing that I could do is I could have her, I usually have people bend a leg in the direction that they're headed. So can you bend your leg up like that? And can you reach with that hand over here? So if she could do that, she could roll herself over like that, okay? Make sure you do have the privacy curtain pulled, because they're going to be in their backless pants and so on. So then I could have her use this hand, which is what I can do, against the bed. Do you see what I mean, to push them up? Try to resist using the bed to bring them up, because that seems like the easiest thing. Oh, here, I'll get her out. Do you see what I mean? Because she's not going to have that at home when we're trying to encourage her to use her muscles. And I'm going to have you drop your legs over the bed, all right, and I'm going to have you right up, okay? Now, she's up.
She's falling apart.
And that happens. All right. And, okay. And usually what I have people do is if they look at the ground, they tend to fall or faint or whatever. So I want you to look up. You look at me, take some big, deep breaths. How's that feel to you? How are you feeling? If she was going to have orthostatic hypotension, I could have taken her blood pressure lying, sitting, you know what I mean, to see where it's going to go. But what ways could I assess the fact that she might be someone's going to have a syncopal episode? I'm looking at her. What's she look?
Pale.
She looks pale. She might be diaphoretic. She might be losing consciousness. She might say, oh, I feel really dizzy, and all that kind of stuff. I mean, you know, I wouldn't like try to get her back in the bed in the perfect position. I mean, even if I had to lay her down, I could get Pierce to come and help me move her. You can take that off. Or fix her hair. Do you know what I mean? I could do that. But my thing is that I don't want her in any way to get injured. That's what I'm trying for. All right, can you come back up here? So let's say, so this is called dangling, where you just let your legs come over the edge of the bed, and doctors frequently order this for people the night of surgery. Okay? Maybe it's a, thank you, sir, different scenario. Maybe they've actually asked for her to stand at the bedside. Okay? So I could have her put her hands on my arms, all right? And I'm going to get down low so my hips are where her hips are. All right? I'm actually holding her knees with my knees. You could actually do that with a patient. And I could rock her forward. 1, 2, 3. All right? I'm going to have you stand up. All right? She doesn't do this. Yeah, she's a little short. All right. Are you doing okay? You're not dizzy? You're not going to fall? All right. So it's that kind of thing. And sit back down there. Yeah.
Could you do this after?
If I did that, I would, I would do this. Because you just can't grab people. You know what I mean? I could lock my hands behind them. You know how physical therapists you're going to see, they have weight belts? They have belts around their waist that they're actually using to be able to guide them. Nursing doesn't do that. It's kind of interesting. I don't know why they get to, but they don't. But they're, in a sense, one way to look at it is, by the time physical therapy is snapping a waist belt around them, nursing has cleared them to be okay with that. Does that make sense? So we know there's no pathology in their stomach or that weight belt's going to be a problem. Would you mind bringing the bed was locked? Because if the bed is not locked, and I go to move things, or I need to lay her back and the bed rolls away from us, then she's on the floor. So many of our actions should start with determining that. So she wouldn't be lying in this position. This is not good. Take care. This is your what not to do. Okay. But I would put the bed, I would put the wheelchair up here. I also have to make sure that the wheelchair is locked. Okay, can you help me?
Yeah.
What I'd like you to do is I'd like you to use this arm, and I want you to go like this.
She's still attached.
Can you just pop the connector that's right in your hand?
Okay.
I think it's a twist.
Got it.
All right, so 1, 2, ready to go. So we'd stand her up, we'd pivot her, all right, and sit her down. Now, she didn't sit right in the wheelchair like we wanted her, and they never do. So one thing we could do is, I'm going to reach forward, like kind of do the fireman carry on her. I'll lean forward. And I could do this. I could actually hold her arms, and I could lift her up. These are mannequins. They don't do this always well. Okay. If we were going to strain her, we could do a lap belt. Remember, if we didn't want her to...
Can I put on some hair?
You and your films. Stop with the films. Just watch me. Okay. or I put a lap belt around her, I would make sure she has her call bell within reach and so on. All right, and then let's say I have to put her feet up. Do you mind putting her feet up on the stirrups? Thank you, sir.
I have a question.
Yeah.
If the person's way bigger than me, how do we get her to, if she's
You ask
on
help.
the bed back, in the chair? How do we lift her from the...
Get your...
Do we still get them the same way?
If they're way bigger than you, you've done a great assessment, and let's disconnect this as well. Can you just hook this over the... Can you hook this over the top of that pole? Then ideally we would use a lift device. So that's why I want to show you a lift device. Okay, so I'm going to put her out of here because we're going to use this bed for ourselves and maneuvering ourselves. So here she's going.
Can we practice on like a real human being?
Yeah, that's what we're going to do in just a second here. I'm going to show you a series of things I'd like you to do while I'm testing people on it.